So Edmund, you're running an ADHD Masterclass for us in May and in September of 2019.
Yes.
Could you explain a little bit about what will the course contain?
Yeah, so the course will have two different elements, and I'm doing it together with my colleague from the University of Southampton, Sam Cortese. So I'm a scientist, not a clinician, and I'll spend the morning talking about the causes of ADHD, reviewing in a way that's very accessible, hopefully, to everybody, the issues around genetics, environments in the causes of ADHD, and the underlying neuroscience of ADHD. And then in the afternoon, Sam will focus on the treatment of ADHD, giving very much an evidence-based approach to both pharmacological treatments. Sam is a psychiatrist, and also non-pharmacological treatments, drawing very heavily actually on the work of an organisation that we're both involved with, which is the European ADHD Guidelines Group, who've conducted a number of systematic reviews. And so we'll very much focus on the evidence for those treatments, but also, given that Sam is a jobbing psychiatrist, there'll be a lot of opportunity to ask questions, kind of cold-face type questions about the kind of practical aspects of treatment.
And in terms of delegates, what type of skill and knowledge level would you advise people who are thinking of attending the course to what level should they be at?
Yeah, that's quite a tricky question, because I think both of us are quite good at making complex issues accessible, and that is definitely our challenge. But I would have thought a basic understanding of the nature of ADHD in terms of its clinical presentation. I guess you wouldn't come if you didn't know what it was a little bit, because you wouldn't be interested. But a little bit about the clinical presentation, and maybe something around the current approaches to identifying and diagnosing ADHD. And I think that would be enough. And I think hopefully you definitely don't need a PhD in neuroscience or genetics, that's for sure. But I think, and you don't even need to be practicing clinically in the area. But maybe wanting to go in, maybe thinking about future career in that area would be good. I think it could be open to researchers, clinicians, but other health practitioners, nurses, also teachers. I mean, ADHD is a big challenge to the classroom as well as the home. So I think it's hopefully very broad. I think that's what we're looking to be able to provide something useful and interesting for a very broad range of professionals.